Welcome to today's Explainer. I'm so excited because today we're doing something really special. We're going on a virtual hospital tour. Usually these spaces are totally hidden away behind those heavy double doors, just filled with the quiet hum of complex machines and intense math. But today, we're pulling back the curtain. We're going to walk the halls, peek right into the clinical spaces, and see exactly what happens from the very moment a patient walks in, all the way to the delivery of life-saving treatment. Let's kick things off by meeting the guy who's actually going to be our expert guide for today's journey. This is Kwanan Chu. He's a medical physicist right here at the hospital. Now, medical physicists, they are the brilliant minds working behind the scenes, basically bridging the gap between human anatomy and high-level physics. He's going to be leading us through his daily environment, showing us this incredible workflow that makes modern radiation therapy possible. All right, so here's our itinerary for today's tour. First, welcome to Radiation Oncology. Second, simulating the treatment position. Number 3, designing the treatment plan. Fourth, we'll go inside the treatment vault. And finally, number 5, the ultimate standard of care. Okay, let's dive into section 1. Welcome to Radiation Oncology. So as we step right through the main entrance into the lobby here, just look around. The very first thing you notice? It's not cold, intimidating medical equipment. Actually, it's the registration desk and this really nice patient waiting lounge. Medical treatments, especially in oncology, can be incredibly stressful, right? So the physical environment here is deliberately designed to be open and welcoming. Whether patients are just checking in for a consultation or coming in for their daily treatments, they've got comfortable sofas, TVs. The whole warm human element is prioritized right from step 1, just to help them feel at ease before any of the complex science even begins. Moving just down the hall, right over here to your right, let's step into consultation room 33. This is the primary clinical meeting space. Before any machines are ever turned on, this is where the really crucial in-depth discussions happen. Physicians and patients sit down together right in this room to thoroughly discuss the diagnosis and figure out if radiation therapy is actually the right course of action. It's this quiet space where, vulnerability really meets medical expertise. It's all about establishing a human consensus before the machinery gets involved.
All right, moving on to section 2, simulating the treatment position.
Now, if a patient does require treatment, a nurse guides them right here into the CT simulation room. And you'll immediately see some pretty unique immobilization tools, things like vacuum cushions and thermoplastic masks. Now, I know that might sound a little intimidating, but they are absolutely vital for patient safety. Radiation therapy is delivered in multiple sessions, which we call fractions. And these tools guarantee that the patient's posture remains perfectly consistent for every single one of those fractions. Take this thermoplastic mask, for example. It actually starts out completely flat, but then it's heated up in a warm water bath until it gets nice and soft and pliable. Then, it's gently draped over the patient's face to form this perfect custom mold. Within just a few minutes, it cools into a rigid yet comfortable shell that ensures millimeter-perfect positioning every single time. And check out the contrast here between the CT scanner we use in oncology versus your standard diagnostic CT scanner that you'd see elsewhere in a hospital. If you've ever had a regular scan, you probably remember lying on a slightly curved, kind of soft bed, right? But look at our oncology couch top here. It is completely flat and extremely rigid. So why the difference? Well, a soft bed allows the body to sink and shift around. A hard, flat couch is strictly designed for flawless positioning reproducibility. It guarantees identical setups for both this simulation and the actual treatment down the line. Also, just look at the sheer size of the opening, what we call the bore, on this GE Discovery RT scanner right in front of us. It spans a massive 80 centimeters. To put that in perspective, a standard diagnostic CT is usually only around 70 centimeters. That extra 10 centimeters of clearance, it's a total game changer. It prevents collisions for larger patients, or for patients who might need their arms raised above their heads on specialized breastboards. It just ensures that the immobilization devices, the patient, and the machine can all move together smoothly and safely, without any accidental bumping.
That brings us to section 3, designing the treatment plan.
So welcome to the treatment planning room. The exact moment a patient finishes up in that simulation room we just left, their CT images are instantly transferred to the computer banks right here. Often, physicians will take those CT images and literally fuse them with MRI scans. Think of it kind of like layering translucent tracing paper. They're combining the sharp, precise bone detail of a CT scan with the amazing soft tissue contrast you get from an MRI. This powerful combo allows them to meticulously contour and define the exact borders of the target tumor volumes right on their screens. Basically, they are quite literally drawing the battle lines. Now, how do we actually figure out how to hit that contour target? Well, we use a highly advanced treatment planning system called Monaco. And the true engine behind this system is something called the Monte Carlo dose calculation algorithm. And guys, this isn't just your everyday math. Instead of using basic averages, the Monte Carlo method works like a massive simulation of 1 billion dice rolls. It simulates the exact randomized path of millions of individual radiation particles as they travel through all the different densities of the patient's body, through bone, through air, through tissue. By modeling these millions of microscopic interactions, it predicts the dose deposition with literally unparalleled accuracy. It maps out exactly how the radiation is going to behave inside that specific patient's anatomy. And that really brings us to the core mission of the medical physicist working here at these computer banks. It is literally a game of millimeters. It's this incredibly delicate, high-stakes balancing act. They have to use these physics algorithms to design an optimized plan that delivers a lethal dose of radiation directly to the target tumor, while simultaneously and maximally sparing the surrounding healthy organs. And once this intricate plan is totally finalized and gets the green light from the physician, it's transmitted directly to our next stop. All right, follow me to section 4. Inside the treatment vault. Step with me now into our final and honestly our most impressive stop on this tour. Before we even look at the machine itself, just take a second to notice the room. We've just walked past these massive, heavy, lead-lined doors and through these thick, winding concrete walls. This is a highly shielded, heavily protected vault where the actual treatment takes place. And right there in the center, that's the linear accelerator, the absolute heart of clinical operations. This massive device generates and delivers the radiation beam. And hey, if you look closely at the bed the patient lies on, you're going to notice it perfectly mirrors that flat, rigid couch we saw back in the CT simulation room. That exact match is what guarantees our meticulous planning translates into physical reality. But, we don't just rely on the hard couch to get it right. Take a look at the onboard imaging system attached to the machine. Every single day before the radiation therapists turn on the beam to execute the plan, they perform a crucial safety check. It's called image-guided radiation therapy, or IGRT. Basically, they take a live onboard scan of the patient right there on the table. Then they compare this live scan to the original treatment plan to verify the patient's alignment down to the absolute millimeter. Only when everything is perfectly matched does the machine actually deliver the radiation safely. And finally, section 5, the ultimate standard of care. Let's step out of the vault for a second, take a breath, and just kind of look at how all these pieces build on one another across this entire journey. We started at consultation, finding the right path with the patient. Then we moved to simulation, locking in that perfect, repeatable position. After that, we went behind the scenes into planning, where advanced physics literally maps out the dose. And finally, we witnessed the execution inside the vault. Every single room we visited represents the seamless kind of hidden collaboration between physicians, medical physicists, and radiation therapists. Honestly, none of them can succeed without the others. So as we wrap up our virtual tour today, I want to leave you with one final thought. We've seen the comfortable waiting rooms and we've seen those incredibly complex Monte Carlo algorithms. When human compassion meets millimeter-level physics, how does this hidden collaboration redefine the future of modern healing? It's just this incredible intersection of care, accuracy, and safety happening every single day. Thank you so much for walking the halls with me on today's Explainer and for keeping your curiosity focused on the fascinating world around us.